ठीक है। तो आज के हम वीडियो में देखेंगे ऑब्स्टेट्रिक इंस्ट्रूमेंट्स, ठीक है। तो आपको ये फेमस वाली चीज़ पता होगी, तो बिना देर के चलते हैं ऑब्स्टेट्रिक इंस्ट्रूमेंट के पास।
Here we got obstetric forceps, Wrigley's forceps, used for holding of baby in normal delivery. Here we got interlocking mechanism, encephalic part and pelvic part.
Okay, and this is a locking mechanism, and these are two separate things. Okay, you can separate them and lock them together. This is a Wrigley's forceps.
Multiple tooth valsalum. Here you can hold this in this finger. We got in the proximal end rachetic, one lock, second lock, third lock, and long shaft. And in the distal we got curved blade with tooth projections. It used for holding anterior lip of cervix, and indications could be intrauterine inseminations and removal and introductions of intrauterine contraceptive device in vaginal hysterectomy.
Okay, this is a multiple tooth valsalum. Here you can see this is a curved thing, joint, blade, finger ring, and 3 ratchets.
Here we got Deaver's retractor with curved blade and huge shaft and holding like this, and used for obstetric cesarean sections, laparotomy, abdominal hysterectomy.
Okay, and in surgery it is used to retract the liver. Next.
Here we got Hegel dilators of different sizes used to dilate cervix.
Okay, and you can see on Hegar's dilator, every dilator has a marking. Okay, you can see the numbers are there. These are different size of Hegar's dilators. Next.
Here we got Rampley sponge holding forceps. It could be used for holding sponge and cleaning surgical sites pre-operative, and used for holding gallbladder in case of surgery if it is enlarged. Okay. Here we got in the proximal end rachetic locks, first lock, second lock, third lock, shaft, and oval fenestration.
Next.
Here we got metallic bivalve self-retaining cuscus speculum used to hold anterior and vaginal valve, used for insertions of intrauterine contraceptive device and intrauterine inseminations, or to inspect cervix or uterus or in injury, bleeding or discharge or leak.
Yes.
Here is an anterior wall retractor.
Anterovaginal wall retractor. Okay, you can see there are multiple transverse serrations, and it is a blunt thing. Okay, don't confuse it with a uterine curette. It is a vaginal wall retractor. It is used to retract the vaginal wall. Next, you can see this is a uterine sound. Okay, there are multiple gradings on the uterine sound. Okay, you can, I hope you can see. This is used to know the retroversion or anteroversion of the uterus, and the contraindication is uterus perforation. Okay. Next. This you can see, this is instruments required for a pap smear. Okay, and the wooden type you can see, this is the iris spatula. Okay, used to take a ectocervix specimen. Okay, next one more thing is a cytobrush. Okay, here you can see this is a cytobrush used to take the endocervix sample. Okay,
and glass slide is there,
and glass slide for mounting for the pap smear.
Next we got Leach Wilkinson cannula. It is long shaft, and the distal end we got conical and serrations. It is used for hysteroscopy and visualizations of uterine cavity and checking for patency of fallopian tube.
Okay, this is also known as HSG cannula. Okay, and from behind you can see, you can remove it like this. Okay, it will come. It is used for hysterosalpingography also. Okay, this is Leach Wilkinson's cannula. Next, this is a Sims bivalve speculum, used to retract the vaginal wall during vaginal hysterectomy. This is the most common one. Okay, this is bivalve, and here you can see a thin this is shallow here. Okay, whatever drainage or secretions are there, they get drained out from here. Okay, this is a Sims bivalve speculum. You should hold it like this.
Here we got Doen's retractor. In the center we got ring for reducing the weight of the instrument, and we got good metallic shaft for holding, and this is for retraction in case of abdominal hysterectomy, cesarean sections, and in surgery used to retract rectus sheath.
Okay, Doen's retractor is used to retract the bladder for LS-ER surgery. Okay, retract the bladder for LS-ER surgery. Doen's retractor.
And here we got Babcock's forceps. In the proximal end we can see rachetic lock mechanism in the proximal part, long shaft. And here in the distal end we got fenestral oval fenestrations for holding tubular structures such as fallopian tube, appendix, uterine tube, and vas deferens and ureter.
Okay, this is the most commonly asked. This is Babcock's forceps. Okay, non-traumatic. It is non-traumatic. Next,
we got curved artery forceps. In the proximal we can see rachetic locking mechanism in the proximal part, long shaft again, and in the distal end it is a curved artery forceps. And you can see the serrations in the distal end in both sides.
Okay, these are transverse serrations. Next.
Here we got episiotomy scissor. You can identify by seeing in the distal end a curved blade and
okay, one is a sharp end, another is a blunt end. Okay, this is given for episiotomy suture, like anterolateral part during vaginal delivery.
Here we got
Green armitage.
armitage forceps. In the proximal end we can see rachitic lock mechanism and long shaft, and in the distal end here you got longitudinal serrations in both the end. You can see.
Yes.
It is used for hemostatic of uterine vessel in case of cesarean sections, or to hold uterine incision in case of cesarean section. There are two indications of green armitage forceps. Here we got Koch's forceps. In the proximal end you can see rachitic lock 3 or 4 levels, long shaft, and the distal end you can see conical projections in both the end.
Okay, one has a sawtooth like, and another has a groove. Okay, you can see here one end has groove and one end has a teeth. Okay, it is used for artificial rupture of membrane. Okay, and it will also hold the tough structures which has a better grip, for better grip. Next. This is a needle holding forceps. Okay, you can see ratchets are there, finger ring and shaft joint, and the blades are smaller. Okay, and you can see there is a small groove. I am trying to focus. Okay, you can see there is a small groove to hold the needle. Okay, the needle is holded from anterior 2/3 and the posterior 1/3. Okay, this is a needle holding forceps. Next thing. This is the Alice forceps. Okay, Alice forceps is one of the most commonly used, and it has a small tooth. Even though it has a small tooth, it is a traumatic type. It is used to hold structures during vaginal hysterectomy, and ligaments, broad ligament and ovarian ligaments. This is used to hold the ligaments. Next. Again, this is a needle holding forceps only. Same thing. Same. It has a small halo used to hold the needle at anterior 2/3 and the posterior 1/3. Okay. It has a better grip and used for suturing purpose. Next.
Here we got curved scissor, Mayo scissor, and same you can see there is no there is no locking mechanism in the proximal part. Long shaft and blades you can see. These are curved sharp blades.
Mosquito.
This is mosquito forceps. In the proximal part you can see rachitic lock mechanism, small shaft and curved with serration in the distal ends.
Okay, this is the mosquito forceps used to hold the small arteries which are bleeding during surgery. So one more thing which was remaining was towel clip. Okay, towel clip which is hold the draping materials, fiber optic tubes and cloths and gauze pieces to hold those things for draping purpose. Okay. Okay, here you can see this is a cervical punch biopsy forceps. Okay, this is used to take a biopsy of the specimen for cervical carcinoma caused by HPV 16 and 18 most commonly. Okay, these are the two forceps. Okay, that is toothed forceps and the plain forceps. Okay, tooth forceps is holding the tough structures like fascia and aponeurosis. Smooth non-toothed forceps, that is plain forceps, is used for holding the soft structures. Okay, this is the uterine curette. Okay, one is a sharp end, another is a blunt end. Okay, it is used during the D&C. Okay, that is dilatation and curettage. Okay, excess of dilatation and curettage can cause Asherman syndrome. That's it. Our obstetric instruments came to an end. Okay, I hope we have covered all the obstetric instruments, and if you like this video, please like, share and subscribe. We have covered all the instruments, and do read about these instruments from a textbook. Okay, Datta textbook or any practical textbook. That's it. See you in the next video. Until then, Jai Hind, Jai Bharat. Bye bye.